All right, well, it's a procedure that's been hailed as a medical miracle, but for one family, the dream of conceiving through in vitro fertilization became a nightmare when they discovered that another woman had been implanted with their embryo. Dr. Sami was part of the team that performed the first successful IVF procedure in New York City back in 1983, but now he will no longer do IVF because he says the risks are too high. Dr. David, thanks for being here.
Thank you for having me.
You have soured on IVF, not just because of horrible stories like this one this week, but for many reasons. Why?
Well, I think there are countless couples that are being advised to do in vitro that may not need in vitro in the first place. There are many treatable causes for infertility, and you don't have to resort to the very high doses of drugs, the risks of these drugs, the risks to the baby, the risks to the mother, and the excessive cost of IVF as well.
What happened this week where the woman was accidentally impregnated with the wrong couple's embryo, that obviously is extremely rare. How could this happen?
Well, there probably was a mix-up, unfortunately, in the laboratory, in the embryology lab. And if there was a mislabeling of the test tube or something, it happened inadvertently. It was not meant as by any means.
Of course, of course. So you say that there are other alternatives. So for the millions of people out there this morning who are infertile and struggling with it, before they get to IVF, or even in lieu of IVF, what are some of the things that they can do?
Well, a very complete history should be done on both the husband and the wife. The field of infertility is unique because you have two patients. And 40% of infertility is actually male-related infertility. So the doctor should not gloss over the contribution of the husband.
Right, because it's often seen as a woman's problem. One thing that I read in your notes that you said that I'd not heard elsewhere, you say simple antibiotics can help cure infertility. How?
Absolutely. A man or a woman could have a very silent infection. If the doctor does not look for it, he won't find it. I've had patients with 10 years of infertility become pregnant in 1 month after antibiotics. You have to look for everything.
Also, there are treatments that people can do that are very simple, that used to be seen as alternative, but I think now have a proven track record.
Right.
Such as what?
Acupuncture, Chinese herbs. Acupuncture does increase blood flow to the ovaries, blood flow to the uterus. Acupuncture could also alter or balance hormones as well.
And how do herbs work?
Herbs can do the same thing with increasing blood flow and balancing the hormones.
Well, your book is called Making Babies, and it's a 3-month recipe, basically, for couples before they get to IVF, because as we've seen this week, it can be risky for a number of reasons. Dr. Sami, thanks for coming in to tell us about it.
Thank you so much.